Hello, gentlemen, and welcome back to Premium Health Vitality. I'm Dr. Sarah Williams, and today we're diving into a topic that most men think about, but very few actually talk about, especially after turning 60. Let me ask you something directly. Have you ever wondered whether it's still safe to masturbate as you get older? Maybe you've worried in private that it might harm your prostate, or that it could somehow weaken your sexual performance. Or maybe you've been too embarrassed to ask anyone at all, so you've simply carried that question silently. Well, let me put your mind at ease. Not only is masturbation perfectly normal after 60, but when done the right way, it can actually support your health, your confidence, and even your sexual longevity. But, and here's the important part, many men over 60 make some very risky mistakes without realizing it. And those mistakes can lead to irritation, discomfort, and in some cases, real health problems. That's exactly what I want to help you avoid today. So stick with me until the very end of this video, because I'm going to share the 3 most dangerous masturbation mistakes older men make, explain exactly why they're risky, and give you practical, medically sound solutions that you can start applying immediately. Plus, I'll reveal when it's time to see a urologist, because sometimes what looks like a minor issue is actually your body's way of sending you an important signal. And I promise, this isn't going to be a dry lecture. I'm going to make it real, relatable, and useful. Because here at Premium Health Vitality, our mission is to give you straight answers and practical tools that help you live your healthiest, most vibrant years well past 60. Now let's jump right into it. The first mistake, one that is far more common than most men realize, is going dry. Yes, you heard me right. Dry masturbation may not sound like a big deal, but after 60, it can be surprisingly dangerous. Here's why. As we age, the skin on the penis becomes thinner and more delicate. The natural oils that once kept it more resilient decrease. Add in the fact that many older men are on medications that can reduce hydration and circulation, and you have a recipe for micro-tears, irritation, and even infections if you're not careful. Think about it. Would you ever rub delicate skin like your lips or under your eyes without some kind of moisture? Of course not. So why treat the most sensitive skin on your body any differently? This is where a good, safe lubricant becomes essential. And I'm not talking about grabbing just anything from the shelf. Many products are full of chemicals, fragrances, or alcohols that actually dry the skin out even more or upset the natural balance. Instead, look for simple, skin-friendly lubricants. Water-based is great if you want something light and easy to clean. Silicone-based lasts longer and can be very protective if dryness is a big issue for you. And for some men, even natural oils like coconut oil work beautifully. Just make sure you're not sensitive to them. The point is, dry is dangerous. Lubrication is protection. It's not optional after 60. It's vital. Now let's move to the second mistake, and this one might surprise you. Too much force. Yes, I know for years, maybe even decades, you've had a certain way of doing things, a certain rhythm, a certain grip, maybe even a certain intensity that worked just fine in your 20s, 30s, and 40s. But here's the reality. What your body tolerated then may actually be harmful now. The tissues, nerves, and blood vessels that allow you to experience pleasure and erections become more delicate as you age. Too much force or a death grip style can desensitize nerves over time, making it harder to feel pleasure. In fact, some men even report difficulty reaching orgasm with a partner because their body has gotten used to an intensity that a real partner simply can't replicate. That can lead to frustration, anxiety, and even relationship stress. The solution? Go gentler. Explore slower, more mindful techniques. Use your whole hand instead of just a tight grip. Change up the angle, the speed, the pressure. Allow arousal to build gradually, rather than forcing it quickly. This not only protects your tissue, but it also trains your body to respond in a more natural way, keeping your sensitivity alive and your sexual experiences with a partner more fulfilling. Now let's talk about mistake number 3, and it's one men often overlook entirely: skipping proper hygiene. Yes, I know it sounds basic, but you'd be amazed how many older men either don't clean properly after masturbation or think a quick rinse is enough. The truth is, leftover fluids combined with warmth and friction create a breeding ground for bacteria. And once again, because your skin is more delicate now, your risk for irritation and infections is much higher than it used to be. So what's the right way? After every release, wash gently with warm water and a mild, fragrance-free cleanser. Pat dry with a clean towel, don't rub aggressively. If you're uncircumcised, gently pull back the foreskin to clean underneath. These small steps make a huge difference in keeping you comfortable and preventing problems down the road. So there you have it, the 3 most common and dangerous masturbation mistakes after 60. Going dry, going too hard, and skipping hygiene. But let's not stop there, because I also want you to understand why safe, mindful masturbation after 60 is not just harmless, but actually beneficial. Done properly, it improves circulation to the pelvic area, which supports stronger erections. It helps maintain nerve function, which preserves sensitivity. It lowers stress hormones, improves sleep, and even boosts your mood, thanks to the natural release of endorphins. It also helps regulate your prostate by encouraging regular release of fluids, which many urologists believe is protective for long-term prostate comfort. So don't think of masturbation as a guilty pleasure. Think of it as part of your wellness routine, like exercise, hydration, or stretching. The key is simply to do it smartly, safely, and with awareness of how your body is changing with age. Now, before we wrap up, let's talk about when to seek professional help. Because while masturbation is safe, there are certain red flags you should never ignore. If you notice pain during or after, if there's bleeding, swelling, unusual discharge, or if you suddenly lose sensation, that's your cue to make an appointment with a urologist. Don't shrug it off or hope it will just go away. Your body is speaking to you, and it's always better to catch potential issues early. So gentlemen, let's bring this conversation full circle. Masturbation after 60 is not something to be embarrassed about. It's a natural, healthy, and important part of self-care. But like every other aspect of our health, it deserves attention, mindfulness, and adaptation as our bodies change with time. When you avoid the 3 big mistakes we discussed, dryness, aggressiveness, and neglecting hygiene, you're not just making the experience more pleasurable in the moment. You're protecting your prostate, your circulation, your nerve sensitivity, and ultimately your confidence in maintaining a fulfilling sexual life for years to come. And here's something I want you to take away. Sexual health is health. It's not separate. It's not something to sweep under the rug, and it's not just a luxury. Your comfort, your release, and your sense of vitality directly influence how you sleep, how you manage stress, how you connect with others, and even how you protect your heart and circulation. A healthy sex life, whether with a partner or with yourself, is an investment in your overall well-being. Now, of course, I'll always remind you of this critical point. If you notice pain, bleeding, swelling, or any sudden changes in sensation, don't delay. Reach out to your doctor, preferably a urologist, to make sure there's nothing more serious going on. That step could save you from unnecessary suffering and help you catch potential issues before they become bigger problems. Gentlemen, you are not defined by your age, and you are certainly not defined by silence on these topics. The more we normalize conversations around self-pleasure and sexual health after 60, the healthier and more empowered men everywhere will become. This is about quality of life, longevity, and dignity. So here's what I'd love for you to do right now. If this video gave you insight, encouragement, or even just made you feel more comfortable with the topic, hit that like button so more men can find this information. Subscribe to Premium Health Vitality and turn on the notification bell so you never miss my upcoming videos, where we'll keep diving into the most vital, science-based strategies for men's health. And don't keep this knowledge to yourself. Share it with a brother, a friend, or even a partner who might benefit. And before we go, let me give you a sneak peek at what's coming next. So stay strong, stay informed, and keep prioritizing your vitality. Thank you so much for spending this time with me today. I'm Dr. Sarah Williams, and I'll see you in the next video.